have TVs on our ceilings, right? Is that they always go, can you move your head? I just want to watch TV. Hi, welcome to The Bite Angle. And today's podcast, we are joined by Dr. Erin.
Hi.
And I'm Bernard, and we're from Dental Designs. So we wanted to speak about a little bit more about kids dentistry, right?
And family dentistry.
Family dentistry as well, yes. And so I guess one thing that we often would talk about as dentists is like, how do you approach families and speak to them about perhaps their habits, but also how do you approach taking care of like a family and their dental needs?
Yeah. I think it's sometimes overlooked because people come in to see the dentist when they have a specific problem, and then they treat the problem, and then they set an appointment or review for themselves, and then they go home.
Yes.
I think it's sometimes there isn't that space or the time to think about, hey, what about the whole family, you know? And I think it's useful to try and introduce that idea or that habit into a family that you guys should have a regular practice that you all go to. Maybe kind of similar to how people often have the same family GP. Yeah. I don't know if that is as much of a habit or concept in people's minds, like a family dentist, in Singapore at least.
Oh, okay. Yes. No, that's true. It really varies, right? And so I've been in Singapore for 24 years now, but a lot of my practice has been in like the expat community, and I even see differences with different communities or cultures. But the most notable one would be the Americans. They tend to be quite well dentally educated. And especially, I guess if they're expatriates from the US, you get a certain level of affluence anyway when they come here, right? So, and when they do, oftentimes you will see the whole family at the same time.
So they do have this idea that, hey, we're going to the dentist as a family, and this is the clinic that our family visits, not just like mom or dad, and then kid goes like somewhere else or to school or something like that.
Actually, and the most interesting thing that the pattern that I've realized is that most of the time the mothers will come in first by themselves. So they're almost like they're checking out the clinic, right?
They're the point of entry.
Yes, the point of entry. But also they are the ones that tries to find out, you know, the culture of the practice and see whether it kind of resonates with how they like the practice to be as well.
I guess that kind of makes sense because a mom often is like the heartbeat of the family, right?
For sure.
They know like their spouse, they know their kids, and they kind of know whether the clinic would fit their vibe.
Most of the time, but not all the time. It's the mom. Sometimes it's the dad. In some cross-cultural families as well, is that I would notice that one parent is way more
invested,
dentally obsessed compared to the other. Yes,
conscious.
Yes, sometimes even obsessed. And then the other spouse will come in and go, oh yes, so what do you think about your kids' teeth? And they will say, oh yes, I think you would ask my husband or my wife about it. Because, they asked me to come, so I came.
I've also seen like the reverse, where I've seen someone bring their teenager or their kid in, and then at the end of the visit they're like, oh, by the way, do you see adults as well? So I think sometimes, at least in Singapore, I think sometimes there's people think that dentists who see like kids and adults are bit separate. So maybe it doesn't come to mind straight away that they can see the whole family in one clinic.
I get that a lot too. So like especially when you are subspecialized in something, or you are interested in one facet of dentistry, they think that's basically all you do. But I actually really enjoy family dentistry. You do too, right?
What do you like about it?
Actually, especially since having kids, I really enjoy interacting with them. And so and they say the darndest things. So
they do.
So the most interesting thing that I realized, we have TVs on our ceilings, right? Is that they always go, can you move your head? I just want to watch TV.
Recently, I had a kid, because so I was in a treatment room where, like in one of our rooms, the TV is in front. So it's not on top, but it's in front of the chair, right?
Yeah.
And then I think halfway through, while we're taking a break, and I was talking to mom, a kid tried to lean all the way over the chair to touch the TV, because I think an ad came up on the video I was playing for him, and he thought it was touch screen. So
yes.
Because they grew up with like touch screens,
but why
iPads
not? Yes.
all the time now. So it's
it's funny.
It's quite funny.
Yeah, but it's very interesting and can be frustrating too. But what I usually would do with the kids, especially if they come in as a family, right? One thing we try to do is create a very conducive environment for communication to be there. So oftentimes, one thing I try to do is interact with the child and not so much the parent.
Yes.
But also get usually the parent involved as well. So I'll just go, have a look at this. And then I'll just speak to them about like the general idea of what we want everybody to follow, right? So it's not only the mom and dad to do like a specific type of brushing, but everybody to do this same thing. Yeah. So is there a specific pet topic or things that you like to share with the families that you see?
So it kind of just related to what you mentioned. I do think it's very important to address the kid quite independently, especially once they're toddler age and they can speak and interact with people. They might be a bit shy, but I think it's really important to kind of really involve them. So I think after a while, then it helps them to make the experience their own. But it's extra helpful, of course, when the parents are right there, or even better, siblings. So it's like siblings together, especially like younger kids below the age of like 10. It's nice I like to put them together in a little group chat, so like ask them together at the same time, like, hey, so especially if their visits if their appointment timings are one after the other, then it's very easy to do so, and just find out from them together how they've been taking care of their teeth, or I usually start from like simple questions like, what flavor is your toothpaste, or do you know like how many minutes you're supposed to brush your teeth for, and then it's easy to make a joke as well when there's two of them side by side, it's like so I mean, in my training, because I used to work a lot with kids, so there is kind of a...
Tell us a bit more about your training. How come you worked with so many children?
I just kind of stumbled upon it a little bit because I worked in the public health system in Singapore. So in the system, we get the opportunity to go to different types of hospitals and practices. So I, by chance, got posted to the school service. So I saw like preschool kids all the way to like high schoolers.
Oh, right.
So that age range, like from 4 to 18. Yeah. So that was where I first got a lot of exposure to kids and teenagers. And then I realized I really liked it. And then afterwards, I applied to get a posting at a children's hospital. It's called KK.
All right, KK Children's Hospital.
Yeah, KKH. Yeah, it's one of the bigger.
Oh, okay.
It might be the only public dedicated children's hospital.
Yeah, I think so, right?
Yeah.
Is it women's and children's or just children's?
It's women's and children, but the dental service was just for kids.
The kids.
Yeah, so it was nice because I got to work under the pediatric dentistry specialist. And so there was like a pretty fixed kind of questionnaire that we go through. Of course, you don't ask it, point blank, but internally you have like a structure to find out about their oral hygiene habits, their dental history and family history. So it's actually very important in the history taking for like pediatric dentistry that you find out like social history and family history. So like siblings, number of siblings, even like order of kids, and also parents' experience with like previous dental treatment that the other kids have gone through. So I think like going through that whole, when you look at how that is kind of put together, it also just kind of subliminally emphasizes the importance of finding out the history of the whole family. So I feel like since then, when I see families, internally I kind of like, hey, it'd be nice to find out about the family as a whole, which I think not just the kids would benefit from, but also the adults, I guess.
Yeah, for sure, for sure.
Yeah.
Yes.
Because it kind of just ties everyone in together, and I think it creates better awareness all around. Yeah.
So from your experience, what is your instinctive idea of this very famous question, which is, when should we start bringing our children into the dentist? Like, when should be their first visit?
I think, as you should know, the standard answer is like, when the first tooth erupts, right? Or first year of age.
Yes.
Yeah, whichever comes first. I feel like when you tell parents this, they're like, oh, so early?
Yeah, so early, right?
Well,
what's there to do anyway, right? It's just one tooth, right?
Yeah, I mean, my response to that is like, hey, just to make sure that everything's on track, and also to start getting them used to the environment. I think that's quite... I mean, you've had kids. I don't have any kids of my own, but yeah, because I mean, what I tell parents is they're just getting kids used to having someone look in their mouth.
That's right.
And wiping around the mouth, even though there's not much teeth to clean, you still want to get them used to that sensation of like having gauze or instruments in the mouth a little bit. I mean, most kids developmentally go along pretty smoothly, but there's still like, once in a while you have kids who are a bit delayed, or the teeth are not exactly erupting in the right sequence or timing. So I feel like as parents, it's always better to be safe than sorry, right? So I do think 1 year is a good place to start.
1 year is good. My general template answer is before the age of 2, and they go, oh, why? And it's the same thing as what you said. What I would add to it too is like, once they reach the age of 2, a couple of things happens. One is that they reach the terrible 2s. So they become more autonomous. So they will say no a lot, right? So, let's go to the dentist for the first time. No.
Right.
The other thing is that oftentimes, and I think you would have experienced this at KK, is that if they have not been to the dentist by the age of 2, oftentimes the first experience at the dentist is from a fall, right? They knock their tooth, and then they see the dentist, and then it's basically imprinted in their minds. When I see the dentist, it's from trauma. And so those are the things that we... so I basically do say to the patients, the parents mainly, is that if you are considering bringing your child in, before the age of 2 will be great, because the teeth have started to erupt already. Then we'll go through like different practices and diets, but also just to make sure that we are a familiar face. If anything was to occur, at least we have already made contact. And also for the parents, it's someone that they can call on for any issues. And so usually I'll already broach the subject of like, when's the next thing that's going to happen in the mouth, right? So if you look in the mouth and you see the lower front 2 teeth that's coming through, I actually give them the whole sequence. I say, these front 2 and then the top, and then and then go, oh, don't be too surprised if the other ones come out, and then the middle ones, right? Because they often would be like shocked.
I think what you mentioned about getting parents to be aware of the kind of habits like dietary and also oral health related that they want to start inculcating early, I think that's really good, because I guess you would know, as kids get a little bit older, then once you try to change a certain habit, it gets harder and harder, and then by the time a problem occurs, you tell mom like, hey, by the way, try to do this less or do that less, and they're like, oh, it's so hard now because they're so used to it, from things like latching, formula milk, bottle feeding, things like that. If you don't remove those habits earlier when you can, it gets harder and harder, right?
For sure.
I think, and sometimes parents just don't know, they don't know that is not ideal, right? And then they probably end up feeling, like they could have done something earlier, and when the kid starts having pain and problems. So, and it's really hard. It's not entirely within their control by the point when the kid is a bit older and the habits are fixed, right? It's really hard to change the habit, I think, past a certain age.
And I think a lot of times it's also just the reassurance to the parents that, you know what, things don't have to be perfect. And I think some of the hardest things that parents deal with is guilt, right? They will go, oh, am I doing something really wrong? Am I feeding them the right things? And, being a parent myself, I think that's really, first thing is like, things don't have to be perfect. The other thing that is often asked most from parents is recommendation for toothpaste, right? I think you'll get that a lot. The other thing is like recommendation for types of food, and what do you think about fluoride, and what do you think of X-rays?
Yes.
Yeah. So actually, what are your thoughts on these things? So mainly the toothpaste. I mean, do you have like a specific thing that a guideline for that you give them?
Yeah, so my general advice would be to, once they have any teeth that are in the mouth, to start cleaning inside the mouth. So whether that's using a cotton pad to begin with on the gums, or then try using a small brush on if they've just a couple of teeth out. When to start using toothpaste, I think once it's a couple of teeth are like around the age of 1/2 to, I do tell parents that, hey, you can try using a little bit of toothpaste, just a tiny smear. A rice grain amount is the guideline that we give. And then some parents are a bit concerned, like, hey, what if they swallow it? I'll usually say just use a very small amount. If you're concerned, you can maybe try to do a quick wipe for them, like right after the brushing, because the kid can't spit and rinse at that age, right? But once they start to be able to like kind of learn to spit, I usually tell them that maybe it's around the age of 3, and once they're around that age as well, if they do come in, I kind of try to practice that with them and encourage them to. I always say like, imagine you're like a merlion, how are you gonna be like a merlion and spit into the spittoon, and if they're doing good, I'm like, yeah, good job,
Yeah.
So and once they get to that age, then maybe like a pea-sized amount of fluoride toothpaste.
Yeah.
The guideline that I give, I'm not sure whether you agree with this, is that if the toothpaste doesn't contain any fluoride, I would say just don't use it. Yeah. Because I don't feel that non-fluoridated toothpaste is that useful or helpful. I think that if you're not going to be using a little bit of fluoride content, then just use a brush. You're going to be able to brush off the bacterial plaque as well. At least that is the kind of guidelines that I received when in my previous workplace. Yeah.
My guideline has changed.
Okay.
As far as fluoride is concerned.
Yeah.
Only because I kind of broadened the scope. What new research has found is that fluoride is just one of a few different types of remineralizing agents that is very useful.
Yeah.
So actually, worldwide, researchers have been trying to find a replacement
For fluoride.
or at least an adjunct to it. So hydroxyapatite is what I use now.
Okay.
Yeah.
Do you find it easy to find on the Singaporean market? Because I've recommended it to some parents before, but I have showed them how they can look for it online. I haven't found it in a shop myself.
Yes, and actually Singapore is very unique in that it's very difficult to find it here. Taiwan is fully on it.
Yeah? Okay, that's cool.
And Hong Kong, very, very big market for hydroxyapatite toothpaste. Japanese have been using it since the 1980s. Can you believe
wow.
it? Yeah.
I didn't know it's been that long.
There's a lot of background history to it, but it's not something new. But it's picking up steam, unfortunately, only because that fluoride has become controversial.
Yeah.
I don't see it so greatly that way. There are certain issues. I mean, certainly water fluoridation, now they're really rethinking it, only because we are wondering how useful is it. Because what we've realized and research has shown, it's kind of like my pet.
Okay, so you're passionate about this topic. That's cool.
By accident. Actually, it was a patient of mine that he was very anti-fluoride.
Right.
So he did a challenge for me and said, can you, he actually said, you should go back and study all your your journal articles again. And he was very anti-fluoride.
Okay.
So I said, look, you know what? I'll meet you halfway. And I say, I'll go back and study all this. But I think your stance is a little bit like too far, right?
Okay, yeah.
You have some people that go, yeah, it's mind controlling. And
right, yeah, that's taking a
very,
little bit
very
too
far
yeah.
right. Yeah. So then I said, okay, let's just see the data. And interestingly enough, there are some researchers in the US especially, professors even. One very famous one is Professor Hardy Limmerback. And he did a lot of the studies that we would have recited for our studies.
In public health.
And he went 180 degrees. He
Okay.
went from pro-fluoride to anti-fluoride now. Okay. But going back to the fluoride issue is that going back to how teeth can become stronger, and they tried to scientifically manage this was just to make sure that if we had enough remineralizing agent, and fluoride being one of them, then and we have it in abundance for long periods of time. It needs to be long periods of time on the tooth surface. Then the tooth can actually reverse, self-repair.
Yeah.
Right? You go from demineralizing to remineralizing.
Yeah.
Okay, this is a little bit geeky, but basically, and I've seen it firsthand that someone had reversed their decay by using hydroxyapatite.
Right.
Better than any fluoride I've seen before.
Yeah.
But interestingly enough, for fluoride, it can work really well for a lot of people, and some people not that well. But if they use like amorphous calcium phosphate, like a tooth mousse, right? That can sometimes work equally as well. Or hydroxyapatite. So there's more than one way to actually solve this issue.
Yeah.
But the question would be of level of safety. So what I give my patients is the option of fluoride and no fluoride. But definitely you're right. I say if a toothpaste does not have any of these remineralizing agents, then it's probably not that great.
Yeah.
Except that if you are so adamant that this is the type of natural toothpaste, I always find it funny when they say natural toothpaste, because it's not like you pluck toothpaste tubes from the tree, right? It's not natural. You've created it. And everything has chemicals, because they go, oh yeah, this is chemical.
Exactly,
So
yeah.
fluoride is a natural occurring substance. So the thing is that if you don't have all these materials in your toothpaste, that's okay. And I have patients that are adamant, and they use like a TCM toothpaste,
Yeah,
like a powder.
Those like organic toothpaste that don't have any remineralizing agents.
Yes, that's right. And it's okay, because if you are someone who also doesn't take any sugar, right? If you are
That's
someone,
true. If you're on the same on the health track,
exactly,
all the way there. Yeah.
So to them, it's like, okay, you are using this, you have a higher chance of getting decay. So we just need to make sure that you don't have risk factors. It's the same thing like if you're going to take a drug,
that's true.
like a high blood pressure drug, you don't necessarily need to take a high blood pressure drug if you don't have high blood pressure. Same thing with teeth. Is that, so I would usually ask them like, what toothpaste are you using? And they go, I'm using a natural toothpaste. But if they have had no decay in the mouth and they're in their mid-30s, they go, doctor, is it bad that I'm using a non-fluoride toothpaste? I'm like, do whatever you're doing already.
Yeah, like if there's no issues. I would tell them that I would tell them that, hey, your toothpaste actually doesn't have anything that could remineralize your teeth, but maybe it makes you feel good. It makes your breath feel subjectively nice, and that's fine. But if they do need something and they have like beginning signs of decay and all that, then I would try to advise them otherwise. But I tried one tube of hydroxyapatite toothpaste. It was given to me by a friend at a conference overseas. I really liked it. I wish that there were more options. I honestly cannot remember the brand. But recently, our clinic, I think the Curaprox has a mouth foam. It's not a toothpaste though. It's like a foam that you put into your mouth and swish around. That it contains hydroxyapatite. So I recently recommended that to a couple of parents who were concerned about fluoride, but they have kids, young kids, like age 3
Yes.
or so with decay. Yeah, so I
Yeah.
wish there was more options on the
Yeah,
market
for sure.
though.
Yes, yeah. And I think it will be time will tell, but I think it's heading that way.
Yeah, I think so too.
Yeah, very much so, and it's very, very effective. So now they're actually researching another material, but I can't say
really?
what it is because
You can't say?
No, I can't say what it is because I've actually asked the researchers whether I can mention it, but it's proprietary and they're still researching it.
Interesting.
So, but it's quite exciting because it's at the same effectiveness as hydroxyapatite.
Right.
Yeah. So again, it's just another method to actually do something without fluoride.
Yeah. I guess like circling back to like topic of family dentistry, I would say that so I would gauge like how the parents feel about fluoride because you can kind of tell some parents are a lot more conscious about it than others. But generally, as a rule of thumb, I think once the kid can like spit and rinse adequately, I'll try to assure them that hey, the amount that is going to the system is very minimal. From toothpaste is very minimal. I mean, there's a lot of fluoride in other things around us, and that they shouldn't be very too much.
No,
I think
definitely not.
Yeah.
I mean, if they're swallowing a whole tube, then that's an issue. But small amount. And actually, the researchers that I speak to, the biochemists, there is actually a dosage of toothpaste, and this is what you can suggest to your patients as well. A dosage of toothpaste that is of maximum efficacy with minimum issues, right?
Okay.
Which is 1 gram. Now, you're not going to measure 1 gram, right? But it's 2 green pea size amounts.
Okay.
Or 1 large green pea size.
Of 1,450.
Yeah. So the interesting thing is that I asked this very specific for the efficacy of hydroxyapatite toothpaste. Now you can use more of it if you want to with hydroxyapatite because everything in there is actually biomimetic, so which means that it's quite biologically natural, right? But for fluoride, it's also the same. But 1 green pea size amount is fine. But they found that actually a grain of rice amount has very little effect.
Very little effect,
but again, it's still better than nothing, right? So more so it's about preparing the kids to be able to be used to the texture and the taste of the toothpaste. And that's the other nuance as well. It's like I try to get my patients, my young patients, off fruit flavored toothpaste by 5 or 6.
Yeah, I think that's what I try to advise as well because like they just like the sweetness of it and then they start swallowing.
And the worst part is that they cannot transition to mint when they're a little bit older. But actually my son was the same thing. Like I didn't give him a choice. So from the age of 2, he was already using a mint toothpaste.
It's like toothpaste to him is just mint.
So at the start, he was like, no, bad. And now it's like nothing.
Yeah,
right?
kids are surprisingly adaptable.
Yes, more than parents. Yeah,
sometimes,
you think so? More than the adults.
And sometimes like parents ask me like, do I need to buy different toothpaste for, because I sometimes have moms who are super diligent and they're saying, oh yes, I have this toothpaste like age 0 to 3 for my youngest one, and then I buy 3 to 6 for my second kid, and then I buy like age 7 and up, and actually it's kind of all the same. Mostly actually, even for the kids 0 to 3 toothpaste, some of them have pretty high fluoride content, the same as the ones they get for older kids.
Yes.
So,
for sure. Yes. And Europe is different, right? So in Europe they have 1,500 parts per million, or 1,450 for whatever reason. It's bizarre.
Yeah, they just 1,450 precisely.
It's kind of like regulatory for them.
Yeah.
And like in Australia, US, it's 1,000.
Okay.
And like you find with the kids' Colgates, right? They will have like 500 or 600 parts per million. Yeah.
I usually tell parents that they can actually just buy the same one. What do you think?
I agree. So the studies again show the safety of it is fine after the age of 3.
Yeah.
It's just the controlling the amount, right? Yeah. And I think the mintiness will already control the amount. They don't want so much toothpaste anyway, which is fine. Now, the other thing that I've realized to be a general consensus is dry, like a dry toothbrush that I'll put the toothpaste on and I get them to brush their teeth when it's dry. What do you think about that? Like, do you get, or do you not say anything? Because I was always, I saw my parents did it, you know, like you will wet the toothbrush, you put the toothpaste on and then you brush your teeth.
I've never thought about that because I always used a dry toothbrush.
Right, yes.
I've never been asked
which is
that
the correct
question
way to do it.
Before.
Yes,
oh, okay.
So
I've never been asked that question either. Interesting.
This is the advice I say to every patient. Dry toothbrush, electric preferably. Different types of electric doesn't really matter so much, right? Where we see that the motorized toothbrushes work so much better. And then with a gram of toothpaste of your choosing, really. But once they're after the age of 3, that's about it. But the other thing, I guess you would often talk to patients about is like thumb sucking. You know, the habits that they have. Perhaps do you come across that very much?
I do. I think sometimes confronting habits is always a little bit more of a sensitive topic with parents.
Yes.
It depends also on the parents and the severity of the habits and also the kid. Like, it's a lot of things together. So you kind of have to read the situation a bit. And I mean, if parents ask, I guess the best case scenario to deal with is when parents come in and they have clear questions on what habits they should be trying to avoid or trying to encourage or discourage. Then that's very straightforward. I can just give them the ideal advice, which is to of course try to go off bottle feeding earlier. Formula milk, try to switch that to whole milk. Like, your kid doesn't need formula milk past certain, honestly, pretty early on, right? Once they can start taking family meals, they should be taking whole milk and family meals if they can. Get off bottle feeding and latching as early as possible. Thumb sucking, pacifier use, also not great for development of the jaws, but depending on the person. So, I mean, if the kid is having already a tough time adjusting, then I try to be more reassuring and give smaller baby steps, like, for example, if kids come in with a bit of a open bite or because of like pacifier or thumb sucking habit, I try to give tips on how to get off the pacifier. Typical advice, put something like bitter or sour on top of the pacifier and things like that. But I also try to assure them, like, hey, it's not too late to stop the habit. It's still mostly their baby teeth. The kids are quite malleable as well. Once you get off the habit and they get older, things kind of hopefully generally tend towards better, right? And things like bottle feeding as well. Advice that I've given would be to just kind of slowly dial it back. Instead of taking formula milk, if you can try to start diluting it so it becomes less sweet. And then maybe I've given this advice before, where maybe eventually you try to replace the bottle of milk with a bottle of warm water, and maybe that would ease the kid of having something sweet in the mouth, but at least they still have something comforting to latch onto at night. But I think discussing habits with parents is always a very necessary topic, which is why it's nice to always see families together. From a younger age.
And exactly, and you can engage with them not just once, but oftentimes when you see the whole family, is that sometimes the dad will come in or the mom will come in and they go, oh yes, I was told to ask this question about my child. And then then you actually get it's a very nice thing to be able to treat the whole family, because again the messaging is consistent too, right?
Do you like to, but sometimes logistically it's quite hard for the whole family to come in and wait for their appointments, one after another.
Yes, for sure.
How do you feel? Would you prefer if you saw the family but maybe at separate appointments or days, or are you also okay with a situation where you see like mom and dad and then your colleague next door sees kids?
No, that is actually ideal.
That's
when
ideal?
It's split amongst other practitioners too. So then usually there's like a collaborative discussion with the dentists, And I love collaborations, yeah, because, and again, as a parent as well, it's like you just feel for the family and just go, okay, you know what, we split everything up. Mom and dad with me, or sometimes when they have very young children, you have to have one child with one parent.
Yes.
Right.
Yes.
So then I will see one child, one parent. The other one will see one child and one parent as well.
Okay.
And,
I think that's a good way to split it.
Yeah, exactly. And then they do a switcheroo, then at least then it really depends.
Yeah.
So usually, I think the most important thing is when we collaborate also with the people making the appointments, because that's has to be very clear. It's like, oh, okay, you're coming in as a family. Why not we try this? It's almost like a concierge type of service, which is what we're going for really, is that we cater to that kind of need. And then, so the things to also look out for whenever I see a family is that I talk about the kids' sport as well. Do they need mouth guards, or safety in play, or what to look out for. There's kind of like a mental checklist now. I have. I'm sure you have your mental checklist. Then I will tell them, look, the jaws would grow this way, but if let's say the child's a thumb sucker, you don't have to worry now. If they're 2 years old, yes, we'll try to wean them off. The sooner you wean off, better. But if not, again, don't feel guilty or fret about it. Just that by this certain age, 4. We know for sure if they're off, we're okay.
Yeah.
All right. But we don't want to, kind of ignore it. But at the same time, there's certain issues that you need to
balance between being like firm but reassuring and encouraging.
Yes, exactly. Yeah. So not enabling, but you just go, look, we're here to help you advise. But at the end of the day, you are the one that have to do the work. Yeah. So also, sometimes I will just lay the groundwork of like the need for orthodontics and what we want to do for expansions with the jaw, things to look out for, like not only mouth breathing, but sometimes we even bring in like an ENT into the picture just to make sure that their breathing's fine. And most of the times they're very appreciative of it, because they don't know what they don't know, right?
Around what age do you start to broach that question?
Actually, I already start the whole process with their first visit. Doesn't matter how old they are. So, but it's, let's say when they're 2 years old already, I say, look, these are the things we're looking out for. No issues right now, but we're going to continue checking on it, right? So the next time again, this is what we're looking at. No issues, right? So, and then we'll go, okay, since there are no issues, 12 months, we'll see you again.
Yeah.
And then I'll also prime them usually far in advance. Like when they reach 5 or 6, especially when their teeth are quite close together, it won't be surprising if we ask you that we need to take x-rays, right? Of your teeth. And then I sometimes would explain to them, usually to the shock of the parents, it's like, why do you need to look at dental x-rays, right? Aren't these baby teeth going to drop out anyway? Or so what if they have cavities in their teeth? Don't you just extract them, right? So different for different cultures as well. Some are super on the ball. Like sometimes they even want crowns on their kids' teeth. Yeah,
they ask about the crowns?
Yes, they go, oh, their teeth look very yellow. Can they have crowns? At the age of like 6, 7, 8.
Okay.
Especially around 7 when their adult teeth come through, and we know adult teeth are a little bit darker.
Yes, exactly.
Right, and their parents, some of them are like super obsessed over that, and so we have to just say no, better not. Or can they whiten their teeth right now? Can you do, like in-office whitening for them? No.
That's
they have
interesting.
To be
I haven't gotten that question.
We get extremes. Yeah, some of them come in with like plenty of cavities in the mouth, and we go, look, I think the hardest thing to broach to them is like, oh, this child then needs to go on the GA and have very major dental work done.
I think when that happens also, and the kid is a little bit older and all the problems that started to come in, it's also harder, like as a person seeing the parent for the first time, to broach the question also of what went a little bit wrong along the way. It's a bit of a sensitive topic, but to me it's a very, very important topic because even after like the treatment and all that, the kid still has to maintain their current teeth and also their future teeth, and sometimes it's really, really important to figure out like exactly what is going on. The parents might be like, oh yeah, we brush and everything, but there's something there that is causing the issues. So if you don't have like an existing rapport relationship, it's kind of a bit more of a sensitive topic, I feel.
For sure. But I don't know about you, but I whether it's sensitive or not, I broach it. I'm relatively blunt, but the first thing I often would say to the parents is no guilt, right? There's really no guilt here. Right. And I actually will tell them, and this is true, I found decay in my own kids' teeth.
Oh, did you?
So what is more embarrassing than having a dentist with kids with decay? Yeah. So that's it. And even and I speak to them about my own diet as well. Like I like my sweets.
Your occasional chocolate.
Occasional? No, I wouldn't even say occasional.
But you said you like dark chocolate, so that's not
I do like dark
that's not
chocolate.
so
Yes,
bad.
yes. I've gotten more dark, but yes. But yeah, I do like my sweets. So there are certain things that you can do to mitigate the problems, right?
Yeah.
It's not like I think a lot of times people feel so dejected because they think that they've been doing the right thing, and it's not right for them, right?
Exactly.
And there's nuances to it. Like some people come and go, no, I don't have any. I don't give my kids any sugar, right? It's like, oh, okay, but how often do they eat grapes? It's like, oh, every day.
Exactly.
And when do they eat their grapes? Oh, they just graze on it throughout the day. That's the problem.
Or they take like vitamin gummies.
Yes, vitamin gummies.
Or they
So
take like
vitamins,
a Milo,
Yes.
So there's a lot of hidden habits in there. So you're right. It's very important not to to let the parents feel comfortable discussing
and just
exactly
say, look,
what's going on.
you're doing your best, but this is the issue right now, and we have to solve it. So it's either this or this, and then after that, we just need to make sure that at least the grown-up teeth are going to be okay, hopefully, right? So, but it's challenging, of course, and I think in Singapore also the other context is the help, the domestic helper,
right? Exactly.
And it's something that we also have to broach because it's like there was one family, they didn't know, but the helper was giving the child a Milo just before bed.
Oh, I see.
Right. Yes. So after brushing the teeth, have a Milo, and then
I've also heard of grandparents being guilty of the same thing, like sneaking kids like candy here and there,
for sure,
things like that.
And they go, oh, you had it when you were a child,
and you're fine.
Yes.
Right.
Maybe not that fine, but So, I mean, do you remember any experiences as a child of like how you had your interactions with your dentist?
I was pretty fortunate but this also speaks to the local culture.
Yes.
Where, growing up, seeing the dentist was to my parents, just a thing you do only when you have problems.
Yeah.
So I found out later on that I had decay in my baby teeth, but I think they didn't cause me any pain, so they were left alone. They were left alone, but I did have a retained baby tooth.
Oh,
And actually my first one, my lower incisor, the right in the center, first one, adult tooth, probably came out almost all the way or something, but my parents brought me to the dentist, and that was my first ever experience at the dentist, like getting numbed up and then having my baby tooth yanked out.
Wait, how old were you?
I was 6.
6, okay.
I was 6. I remember being a little bit traumatized by it. I remember feeling like so strange, like that the numbing feeling. And I remember afterwards, it's kind of funny, but I was in a waiting area in the clinic, and I think my parents were probably talking to the receptionist and making payment and whatnot. And I just like passed out on the couch not literally, but I remember feeling super woozy. And I was like, oh no, everything is so strange. I think I was fine. I think I was just feeling really weird and numb. And that was my first time ever at the dentist, and that was being done to me. So, yeah, it was a interesting experience. Yeah, probably another good reason to have seen the dentist earlier than that. So that wouldn't have been my first contact with a dentist.
Yeah, I think it's very important that we slowly change that culture. I think the school dentist programs are very good with that too.
Yeah.
Because I think in not only in Singapore but in a lot of parts of the world, there's actually a famous, not famous, but there's a book called Teeth by Mary Otto.
I haven't heard of that one.
Yes, she's so she talked about she used teeth as the context for inequality in the US.
Okay.
And talking about the severe, surprisingly high death rates of people from dental infections, like wisdom teeth infections, because they are uninsured, right? And then you have the other extreme where you have the pageant queens that have veneers changed every 2-3 years. So she was saying that it is a show of the greater gap between the poor and the rich, but where the cultures do very well. Like in Australia, they have a program in the schools as well. So it doesn't matter from what level of affluence you're from, you will have the basic dental care, right? Until the age of 18. So actually, the statistics we found is that in Australia, is that the most amount of dental problems now happen between the ages of 18 and 35, because
that's when people get off the
they're starting work. They're afraid that the cost of dentistry is high. So it is really very important that if you can, the most affordable way to do dentistry is to do preventative dentistry.
Exactly.
Right?
You want to find, and this is not even just for dentistry, it applies also for medicine.
Yeah.
Like you want to find somewhere and establish a baseline for a rainy day. You don't want to want it to be storming and then be like, oh, I need a place for shelter. I need to solve this problem, that problem. By then it's often a lot costlier.
Yeah, exactly.
So the other thing that you mentioned about like problems coming from the ages of 18 to 35, I have thought about this and I discussed it with one of the specialists I worked with before, is that they do say lots of good things about the school dental system, but they also always advise parents to still have, well, maybe not a family dentist, but at least a dentist. Well, I would think it should be a family dentist outside of that. Also because the kid is used to growing up with a family dentist, and then when they have their own means and they're taking charge of their own health, they know that, oh, I already have a place that I go to, plus I should be going to someone, instead of it not being part of their awareness, and then only later on in life then they come back to see the dentist again. I don't know if you've ever gotten this working in Australia, but in Singapore sometimes I've gotten people come in and be like, oh yeah, I haven't seen a dentist since school, and they're in their 30s, and then they come in with some problems, and I'm like, oh, when was the last time? Oh yeah, probably when I was in school, so like 15 years ago. I'm like, okay.
Very much. We see it everywhere, and again, it depends on the level of affluence. I have seen families that are so ingrained into them that seeing the dentist every 6 months is the thing to do. It becomes like a family event, right?
Yeah.
And then you have ones where, and it doesn't matter whether they are local or not, but it depends on the culture that was set by the parents from the start. But when the kids or the parents, when they come in, there are some that come in at the age of in their mid-30s, and it would be their first visit ever. Sometimes they didn't even go to the school dentist, where the parents may have refused for the child to go. But I don't know how it works here. I mean, you can opt out, I guess. You have to give permission, right, or something.
You can opt out. Yeah.
But if not, it's basically a default, given that you have to have at least a checkup, right, with the dentist, just to make sure things are okay. Yeah.
And the thing is that, of course, there's always cost involved, but like you mentioned, preventive care is always better. And to be honest, I think that preventive care, well, I think it averages out to maybe even be slightly more affordable than spending other money when the problems come
very
up.
Much,
right?
for sure.
Yeah, especially if you're seeing the same clinic and you're not undergoing like a first consultation every time you see the dentist. Your records are all there. You're not going through like a ton of x-rays every time a new problem arises. You already have something to refer to. I think that's
I think super important is that I think moving forward we're planning to do that, is to be able to enable our patients to at least have some type of record of their own, right? Yeah. So actually, I don't know whether you know this, but we are starting a kids smile passport, right?
I heard about it. I saw the samples. I haven't seen a physical one yet, but it looks super cute.
Yes, and so that's what I've been doing for quite a number of years now.
Yeah. Did you make your own previously? You designed it yourself? Okay.
So we, it was kind of like a team effort, but the main parts of it is just so that we just thought it'd be super cute that the kids will come in with their own passport and we'll have a stamp.
Yeah, and it makes them feel excited to come.
It's a report card, right?
Yeah, it's something that I've always wanted to do.
Yeah.
In the past, and I'm super glad that we're doing it now.
Yeah. So it's just creating that excitement that it's not, because when my kids go to see the pediatrician, they actually have a kind of like a report book, so how the vaccines are going, and we should have that in dentistry. And the everybody should be able to keep track of their own records, so that they're not beholden to a place whether they're going to tell them what they have done or not.
I think that's super important, and I am very happy that our clinic keeps pretty good records, like from photos to X-rays and all that, because I think a lot of people don't know that is something that they can expect from a clinic, and oftentimes they hop from one to another, not knowing that they could actually have more continuity of care. I think some clinics do it better than others. For sure. So like how we take photos habitually, sometimes I take photos for the kids as well, depending on especially if it's like an oral. For my kids, most of the time, I think when I take it, it's more for oral hygiene purposes, and it's kind of cool. Like most of the times, the kids they see the difference. So I would clean first, and then we take a photo, and then they're like, oh yeah, I'm like, oh, do you see your teeth are wider now, right? You see all the gunky stuff, it's gone, and they go, oh, because and I think it's cool that we can do that, because in my previous workplaces we didn't use cameras so habitually, exactly. That's been
it's very unique.
Been fun.
Very, very unique.
So even for kids, taking photos is quite a
it's
great
fun thing because to do. A picture paints 1,000 words, right?
Exactly.
You don't have to describe everything. Records. Just go, oh, this is what it looks like, and then you can compare it, right? So that's always great. And then I think it empowers everybody. Anyway.
I think so.
But it's great to know that not everybody loves seeing the whole family. Some people are very, very much siloed and focused into one specific thing. But it is really the most fulfilling part of dentistry.
It is. And I think that, at least in our practice as well, there's a lot of people that you can, not a lot, but there's quite a number of options with multiple chairs running. So even if someone doesn't want to see
for sure.
then you can still arrange side-by-side appointments.
We're going to cater the needs for everybody, pretty much,
and the waiting area is quite pleasant. I think the kids enjoy looking at
the space,
the little knickknacks around the space and the sofas. And
I wish I had that as a kid. Right.
I'm also excited to see the new waiting area at the new branch. Have you seen?
Yes, we've seen it, but I think everything is pretty much set up. So it'll be good.
Okay, that'll be really cool.
Yes.
Yeah.
Well, thank you. And then I hope that this has been quite useful for everyone. But the take-home message is basically that we see the whole family, and we love to actually see the whole family so that we can actually give you a proper message of how you can empower yourself to take care of your teeth. And there's more than one way to do things in the correct manner that is right for you. So
Exactly.
yes, and you can see multiples of us.
Plan a family outing.
Exactly,
to
a family
dentist.
outing at the dentist. It will
Honestly,
make it quite fun.
it's fun. I feel like every time I see a whole family come in together,
It is
everyone's
really
having
fun.
a pretty good time, you know?
Yes, yeah.
And everyone knows that they're there to get their teeth checked out, everything
Yes,
is going
yes,
to be
exactly.
great, and they leave
Yes,
happy. So
yes,
it's always very
yes.
nice to see that.
We
Yeah.
always wish for that.
And high fives all around.
Yes,
It's always a
okay.
good time.
Yeah.
Yeah.
Thank you for joining us again at Bine Angle.
Thank
See you
you.
again.